I'm Josh, medical correspondent. Today we'll be talking about the anatomy of and common injuries to the knee. The knee is a joint containing three bones, the first being the femur, or the thigh bone, the patella, which is the kneecap, and the tibia, which is a larger bone in the shin. At the end of each of these bones is a tissue called cartilage, which allows for smooth movement within the joint, as well as absorption of shock due to everyday movement. The movement of the knee is governed by two muscles, both contained in the thigh. The first being the quadricep, which is at the front of the thigh, which functions to extend or straighten the leg, and the hamstring, which is at the back of the thigh and functions to bend the knee or contract the leg. In addition to the muscles, cartilage, and bones in the knee, there's a series of tendons and ligaments, ligaments being the ACL, MCL, PCL, and LCL. The ACL and the MCL are very common sites of injury, as we saw in the 2006 Super Bowl playoffs with Carson Palmer injuring both of those with one hit. The function of the ACL is to sort of stabilize rotation within the knee, to prevent the knee from twisting too much one way or the other. However, sometimes in sports you'll have a foot planted and your body will twist one way or the other, such as in basketball, when your foot's planted you're pivoting. And what will happen is the ACL will stretch upon this twisting motion, and depending on the degree of the stretch, it will either be pulled or torn. The same case is true with the MCL. However, rather than providing rotational support, it provides linear support to the knee. And what happens when you're playing a contact sport like football or hockey, if you get a large impact to the outside of the knee, what will happen is the MCL will stretch, and in the same case, depending on the degree of the stretch, you'll either pull or tear the MCL. So depending on the severity of the injury, the rehabilitation program can take anywhere from 2 weeks to 6 months or more if the injury involves surgery. But in any case, the rehabilitation program will involve strengthening exercises which allow the muscles and the ligaments to regain strength so that they continue offering support to the knee. And with patience and adherence to a strict training regimen outlined by a doctor or physical therapist, the individual with the injured knee can safely know that their knee will regain strength and they'll be able to go back to the active lifestyle that they had before with little consequence due to the previous knee injury.